to put your socks on if you're hypermobile? That's one of the questions that I am asked. And frankly, I have seen injuries as a result of putting the socks on incorrectly. So if you're a normie, it may be okay because your balancing yourself is a little bit easier than a bendy individual. So we can be standing up and putting the socks on. I do not at all advise my hypermobile patients to take that chance. It's one of those things that is going to potentially, especially if you have not proven to your brain that you are really hardcore and solid on the balancing situation. So it's not like trying to double up on balancing and putting socks on at the same time, or you just want to be a fighter and you want to fight this. This is just one of those things that you got to build your way. If that's your goal, it can be done, but perhaps not today. So if I were hypermobile wanting to put my socks on, I would sit down on my bed or on the floor. I would not, if you have bendy fingers, compression leggings or socks may be difficult for you to put on or take off. So you got to evaluate your situation. Generally speaking, when it comes to compression clothing that you have to put on and take off, 20 to 30 millimeter mercury pressure is what you want to have. Anything tighter than that can cause issues. So you got to keep these things in mind. If you are bendy and you want to put your socks on, sit down on the floor and just put the socks on that way. Don't try to grab like this and just go boom like that, because that may actually cause issues depending on your level of bendiness that day. Each and every day, your level of bendiness can change. That does not mean you're getting worse. This happens to all of us, especially if we're female, because our hormones change and the hormones impact the level of stretching of the ligaments and connective tissue. So back to what we were talking about, putting the socks on, you sit down and put it on, and just grab your socks and perhaps do something like this. Just gather them all up and just gently press them on. I already told you about the compression garments in general and what to look for. I hope this helped. If you are bendy, please make sure you see providers who are used to treating patients with hypermobility. And the second best to that is a provider who's anxious to learn more about hypermobility. The way your body responds is different than the non-hypermobile population, and you don't want to be the guinea pig for that provider to just realize, oh, I should have done this, if they even make that realization. I hope this helped, and until next time, take care.